Generally speaking, anytime a biopharma company is plowing new ground with its pipeline in a new therapeutic area, it's very important that they're thinking early, well before launch, about breaking down any potential access barriers, whether that's making sure that they can generate evidence to get the approval and recommendations that they're aiming for, making sure that payors will be ready to cover the product, and ensuring that the product is accessible to patients at the appropriate time in the patient journey. And that's really what I do at the heart of my work, is helping clients get out ahead of those issues and really shape the market in advance of launch. The rollout of vaccines from the EUA to distribution and the last mile has taught us a lot about the vaccines marketplace and public health in this country. And we saw a tremendous strain on public health as it rolled out the vaccines. And that signals a need for conversation about public health funding and infrastructure investments. And I think, now with the administration proposing in the president's budget the creation of a vaccine safety net, it creates a very important conversation about accessing vaccines across the lifespan, particularly for the uninsured in a post-pandemic context, as well as creating the infrastructure that we need to really vaccinate every American, whether that's in a future pandemic or just on a routine basis. As products transition from emergency use authorization status to full approval, this is something that companies are going to need to navigate with the FDA. And we also saw, relatedly, unparalleled liability protection for those companies under the PrEP Act. And that's something that will come to an end as those products reach approval status. More broadly, there are a lot of questions looming about the coverage flexibilities that we saw during the pandemic. And in particular, I think telehealth especially is an area where we saw a lot of flexibility in government healthcare programs. And we saw a spillover effect in the commercial market as well, where private payers were offering that same flexibility. After the public health emergency is over, it will require an act of Congress in order to extend some of those flexibilities. And I think that payers and policymakers are going to be asking, where does telehealth bring the most value in healthcare? Is that for people living with chronic conditions? Is that for acute episodes where we often see the need for return visits after the telehealth visit? Finally, I see many opportunities to expand access to preventive care beyond vaccines. It's something that I've long been a proponent of, is building off of the Affordable Care Act's preventive services requirement, which requires payers to cover preventive interventions without cost sharing. And I think there's a lot of opportunity to expand access to preventive services, and that includes thinking about mental health interventions as preventive health.